Hello again and welcome back to our discussion. We're talking about slowing down the process of aging and disease. Now, Dr. Meschino, the big question is,
Yes.
once disease starts to take root, you know that your cholesterol is high, your blood pressure is high, and you may have a few other symptoms. Is it possible through radical diet changes, maybe supplements, to actually start to reverse the process?
Well, when you're in the early stages of certain conditions, this is where the combination of good medical practices with intelligent lifestyle and natural medicine intervention should come together to give the patient the best outcome. And this is really what's missing in the healthcare system, is this communication between the two worlds. But I'll give you some examples of where these things work together very nicely. A couple of years ago, it was demonstrated that Parkinson's disease, as an example, the underlying cause is that the part of the brain that makes a chemical called dopamine is impaired. And so when you can't make the chemical dopamine, you start to shake and you have the tremors, and that leads to progressive nerve damage over time. But the question was, why can't that part of the brain make dopamine? And we now know the reason it can't make dopamine is because that part of the brain runs out of a nutrient that it used to make for itself called coenzyme Q10. So studies now show that if you give early Parkinson's patients high doses of coenzyme Q10 supplementation, that part of the brain can still make the dopamine, and it slows down the progression of the disease very dramatically. How about that? But it's not being applied in standard medical practices in many instances, and it should be. I'll give you another example. Early stage cervical dysplasia, a precancerous condition of the cervix of the uterus. Some studies have shown that during the watchful waiting phase, doctors say, well, these are not cancer cells yet, but they're on their way to being cancer cells. Let's just watch what happens over 6 or 12 months. During that phase, if women get high doses of beta-carotene or vitamin E, that those cells often change back to normal cells, and on the next pap smear, they're normal. Cases of high cholesterol, in the majority of cases, can be brought down to normal without drugs by using a low animal fat diet, more dietary fiber, aerobic exercise, and then adding a supplement called gum google, which is a type of naturopathic medicine that in the Indian medical system they use because it lowers cholesterol without any side effects. If that doesn't work, then let the person go on to the cholesterol-lowering drugs, because you have to get your cholesterol down. But in a very high percentage of cases, those cholesterol-lowering drugs are not required. And why would I say try to shy away from them? Because they have side effects, whereas the natural interventions I just mentioned to you don't have side effects. So you want the safest, most effective
You're giving
therapy.
amazing information, Dr. Meschino. Is there any way to cheat? It's a terrible question to have to ask, but I know it's on the mind of the viewer.
Well, you know, day to day, I mean, as good as my own diet is, and I exercise every day, I take the supplements that are appropriate for me. I do the good things. But we all need an outlet. And most people can live with a lower animal fat diet and keeping their dairy fat intake lower, using olive oil instead of the other oils. But in the area of cheating, it usually comes down to 4 categories of in-the-moment temptation: ooey gooey, chippy dippy, frozen desserts, and bars.
That covers it.
Right? So in the ooey gooey category, you have, cakes and pies and pastries and croissants and donuts, and people are tempted by these things, butter tarts. In that area, what you want to do is eat the least amount of fat, because your body can metabolize sugar, and it's the fat that's most dangerous. So a piece of angel food cake, a low-fat biscotti, something where you're getting something that's a bit sweet but doesn't have the high fat content, that's your ooey gooey solution substitution. For chippy dippy, instead of potato chips and nacho chips and tortilla chips, you're better off with pretzels and low fat popcorn. Those are better alternatives because you're going to want to do something. For frozen desserts, instead of the ice creams and the rich frozen desserts, sorbets and sherbets in the moment can satisfy that craving. It's sugary, but the fat content's lower. And then for bars, instead of chocolate bars, and people eat a lot of chocolate bars, and chocolate bars have a lot of saturated fat, which raise cholesterol, create obesity. You're better off with, there's granola bars and low-fat protein bars and snack bars that are lower in fat.
Wow, nice to know, Dr.
Well,
Meschino.
we all need these interventions.
A wealth of information. Thank you so much for joining us today.
My pleasure. Thanks, Christine.
And that's all the time we have for today. See you next time. I'm Christine Williams, and from all of us, thank you for watching.